Hi, my name is Linus. I want to share with you how I discovered that I had gotten graft versus host disease on my lungs and how the diagnosis was set. 4 months after I had my bone marrow transplantation, I was out training on my bike. I had been training very much since the transplantation. In the beginning, I could only walk fast for a short while. But after a couple of weeks of many short daily training sessions, I started to jog very gently for 20 to 30 meters in intervals during my walks. Then I gradually built up my body, so after about 3 months I could jog continuously for 3 kilometers. It was a feeling of victory when I could jog for more than 1 kilometer without being totally breathless. Unfortunately, I pushed myself a little bit too hard, so I got a lot of pain in my right knee while I was running. That's why I was out on my bike training and not out running this day. When I came to a steep part of the road, I noticed that I needed to breathe heavily. And it went worse. I was breathing as fast and as much as I could, but it was like nothing happened. Ventilating my lungs at the max, but still a strong feeling that I needed more air. When the road got flat again, it took me a very long time before I could slow down my breathing again. By then I was a little bit worried of what had just happened. It was very clear to me that my lungs did not work properly. I had not been training on my bike before, so I was wondering if it could just be that I was a little bit insufficient with the oxygen on the bike. 2 days later I had an appointment with the doctor, so I told the doctor about the shortness of breath during my bike ride. But since I could walk and do normal everyday things without needing to breathe more than normal, there was probably nothing to worry about. I also told the doctor that I had a bubbling sound I could hear from my breathing, but only in the evening when I was going to bed. The doctor listened to my lungs, but could not hear anything wrong with my lungs. It is very easy to draw wrong conclusions like this, and I can remember that I agreed with what the doctor said. The day after, I went out on a new training session with the bike. This time I experienced even worse breathlessness. After the ride, my pulse didn't go down and I had to continue breathe very heavy. After about an hour of heavy breathing and with a heart beating as I was still out training, I realized that something was very wrong. So I called the hospital. It was Eastern, so I had to talk to a doctor that wasn't specialized in handling post-transplantation patients. Even though the doctor was specialized in hematology and probably well qualified to handle my situation. 1 month earlier, I had done a lung function test called spirometry, and the doctor could see that my lungs was a little bit obstructive. The maximum amount of air that you can blow out in 1 second is a very good indication on how your lungs work. And that is called forced expiratory velocity in 1 second. That value had gone from 98% of expected before the bone marrow transplantation to 82% of expected 3 months after the bone marrow transplantation. This is pretty normal and nothing to get bothered about. The doctor thought that the best thing to do was to give me a bronchodilatator, so he prescribed Bricanyl. I took the Bricanyl, but symptoms got worse. So the next day, I called the hospital again and got advised to take more Bricanyl. I could feel a very small improvement of Bricanyl, but still, I could feel that my lungs were getting worse for every hour that went. After 2 more days, my breathing was so bad that I just walking made me breathless. Eastern was over and I had an appointment with one of my doctors from the transplantation team. The doctor put me on 50 milligrams of prednisolone, and just after an hour my breathing was feeling much better. Some additional tests were also done. My liver values were a bit off, which was an indication of graft versus host disease. They also did some testing for virus and bacteria. They found that I had an ongoing metapneumovirus infection, and that could explain my symptoms. There are no treatment or vaccines for metapneumovirus, so symptomatic treatment with a high dose of cortisone to lower the inflammation in the airways and the lungs caused by the virus was the best option. A week later, I had another appointment with the doctor. Prednisolone was lowered to 40 milligrams per day. CT scan had been done prior to the visit, but that did not say anything for certain. Had some questions regarding graft versus host disease on the lungs, but did not get any answers. The doctor just said, "We hope you don't have it." 1 week later, another appointment with the doctor. Prednisolone was lowered to 30 milligrams per day. The doctor had been talking to another doctor that was specialized in infection medicine. And all of my symptoms could come from the virus infection that I had. So this gave me some hope that I did not have graft versus host disease on my lungs. Another week, an appointment with the doctor. Prednisolone was lowered to 20 milligrams per day. 1 month after the virus infection, I was booked for spirometry again. I was so surprised that the test procedure that I had done with ease 2 months earlier was now very hard for me. My forced expiratory velocity in 1 second had gone from 82% of expected to 34% of expected. By now I could walk and do easy normal things. Go up for the stairs would make me a little bit heavy in breathing. I just wonder how bad my lungs was before I got the cortisone and I had the virus infection. Week by week we tried to lower the prednisolone level, but when we got down to 5 milligrams of prednisolone, I got worse in my lungs again. The doctors had meetings, and in the beginning they didn't think that I had graft versus host disease on my lungs. But after I had some more mild virus infections that made me breathless of just walking, the doctors came to the conclusion that I had graft versus host disease on my lungs. And 3 months after I had my first symptoms of breathlessness, the doctors told me that I had graft versus host disease on my lungs. What I've learned from this is that it is very important to monitor your body and be able to communicate that so the doctors can understand. If you just tell them that I did feel more tired of walking today, that is usually too vague. Let's say you take a walk every day that takes about 25 minutes, and then suddenly, one day it takes you 30 minutes and you also got much more tired than usual. This will be much more objective for both you and your doctor. So finding good ways to monitor a training is important. I was a little bit unlucky. I changed from running into cycling, which made me uncertain about my shortness of breath. The metapneumovirus did not make me feel sick in the normal way. I took my temperature regularly during these days, and it was just during one time it went up a little bit. I usually have around 36 to 36.5 degrees of Celsius. On one occasion it was up to 36.8 degrees, which in medical terms is not even considered having a fever. The only real symptoms was actually the shortness of breath. I pushed on with my training for some days during the virus infection, and that probably made things even worse in my lungs. So don't push if you feel that something is wrong. To sum up things, after you have had a bone marrow transplantation, make sure to start some kind of exercise as soon as possible and find a way to monitor it as objective as possible. If you start seeing a drop in conditioning, contact your doctor as soon as possible. And make sure to give as an objective information as possible. Shortness of breath and lung function tests are probably the two most important factors when it comes to set the diagnosis. And it can take some time for the doctors to come to a certain conclusion, which I think is very wise. Graft versus host disease on the lungs is a very serious complication from bone marrow transplantation. 10 years ago, 9 out of 10 that got diagnosed with graft versus host disease on the lungs were dead within 6 months. As of today, there isn't any standard treatment for the disease, but the survival rate has gone up, so more than 70% are alive after 2 years. So there is still hope if you get it. A good relationship with your doctor and early detection of the disease is very important for the outcome. Thank you very much for watching. I really hope that this video can help someone. I remember when I had a lot of questions when I first was diagnosed, but find it very hard to get any good information. If you have any questions or input on the content, I'll be happy if you write it in the comments below. Take care.